Well, thank you very much, everyone. Got a very big day today. I want to start by saying that our love and prayers of every American continue to be with our fellow citizens who have lost a cherished friend or family member to the virus. Amidst our grief, we're making tremendous strides against this invisible enemy, thanks to our aggressive campaign against the virus and the extraordinary talent of our medical professionals. Our mortality rate remains roughly half of that of many other countries and one of the lowest of any country in the world. And that's due to a lot of things, but our medical professionals have been incredible. Since we announced our guidelines on opening up America, as we call it, we say opening up America, and we add the word again. I think we can add the word probably again, but that's what it is. We're opening up America again. 20 states representing 40% of the U.S. population have announced that they are making plans and preparations to safely restart their economies in the very near future. So that's 20 states. It's about 40% of our country. They're moving along pretty quickly. 3 announced today, as you know. And they're going to be doing it safely. They're going to be doing it with tremendous passion. They want to get back to work. The country wants to get back to work. A short time ago, the Senate passed the Paycheck Protection Program and Healthcare Enhancement Act with additional funding for the Paycheck Protection Program, hospitals, and testing. A lot of money for all of them, especially for our workers and our small businesses. My administration has worked aggressively with Congress to negotiate this critical $482 billion funding package. We reached a deal that includes $382 billion in crucial small business support to keep workers on the payroll, $75 billion to aid hospitals, which really need the aid, and very badly, very proud of that, and $25 billion to support coronavirus testing efforts. I urge the House to pass the bill, and they're going to be voting on it, I imagine, very, very soon. I think while we're here, and so he's a very busy man, as you know, Secretary Mnuchin, he's going to be running back, so I thought we'll talk about that now, and we'll take a couple of questions on that, and then he can go and start phase 4 as the ink is drying. Probably they'll be voting tomorrow in the House, but shortly, and I think we have tremendous support. So, Steve, please come up, say a few words. Steve? Yeah.
Thank you, Mr. President, and thank you for all your work with us to get this passed. I'd especially like to thank Mitch McConnell and Chuck Schumer and the entire Senate for passing this. I'd also like to thank Kevin McCarthy and Nancy Pelosi, who have been working with us round the clock as well, and our Chief of Staff, Mark Meadows, who was also very instrumental in this. Let me just comment. We've had tremendous support for the PPP. This gives us another $310 billion for the PPP. We look forward to the House passing this tomorrow and being up and running quickly after that. This also gives us $50 billion for disaster loans, EIDL loans, that will allow the SBA to make $300 billion of disaster loans, all for small businesses. Also allows us, as the President said, more money to hospitals and unprecedented amount of money for testing. And again, I think we understand hospitals, not only the hospitals that have been impacted by coronavirus, but more importantly, many hospitals that have been shut down, and making sure that the doctors and nurses get money. Now, let me make just one more comment on the program. We have over 1 million companies that have received this with less than 10 workers. So there is very broad participation in really small business. I will comment, there have been some big businesses that have taken these loans. I was pleased to see that Shake Shack returned the money. We will be putting out some FAQs. There is a certification that people are making, And I ask people, just make sure the intent of this was for business that needed the money. We'll put out an FAQ. But again, the intent of this money was not for big public companies that have access to capital.
And not for Harvard, you might say.
So, Mr. Secretary, are you going to request that those other companies, 'cause obviously Shake Shack was not alone in being a big company that got money in this, are you going to be
I'm
asking?
going to request.
You're going to ask them
I'm
to,
gonna
to
request.
return that money?
Yep.
Yeah, I would.
Harvard's going to pay back the money, and they shouldn't be taking it. So Harvard's going to. You have a number of. I'm not going to mention any other names, but when I saw Harvard, they have one of the largest endowments anywhere in the country, maybe in the world, I guess, and they're going to pay back that money.
And I just want to clarify,
They shouldn't
because
have taken
certain people on the PPP may have not been clear in understanding the certification. So we will give people the benefit of the doubt. We're going to put an FAQ out, explain the certification. If you pay back the loan right away, you won't have liability to the SBA and to Treasury. But there are severe consequences for people who don't attest properly to this certification. And again, we want to make sure this money is available to small businesses that need it, people who have invested their entire life savings. We appreciate what's going on, and they're hiring people back.
And how are you going to ensure that those small businesses, those small restaurants, cafes, bars, who did not get the money last time around are going to get it this time?
Well, as I said, there are a million of these companies that did get it that are very small. We're working with the banks. We're extremely pleased that the small banks did great. 20% of the loans were made by banks of $1 billion and less, 60% by 20 billion and less, and the big banks also. We want everybody to participate. There's now a lot of money back in the program, and we look forward to all these small businesses getting access to funds. Brett, it's great to see you here.
Thank you, Mr. Secretary. Do you estimate how long this is going to take? That other pot of money obviously went quickly. Do you assume this is going to go quickly as well?
Well, let me just say, we're pleased with the success of this program and how quickly this got up operationally. We've put out more money in these SBA loans than in the last 10 years of SBA. So I want to thank all the banks that have worked really hard. We knew that when we passed this originally, if there was full takeout, we wouldn't have enough money. That's why we've worked with Congress for more money. And this is going to, we've already impacted about 30 million workers. There'll be a lot more. So we look forward to this having a big impact on the economy.
Yesterday, the president said he would look into the issue of felons, those with criminal convictions, getting access to some of these programs. I was wondering if you have an update on that.
Sure. So we worked with the White House on this. There were actually much more onerous restrictions in the SBA program. There were people who had misdemeanors that weren't allowed to access the program. It was much longer than 5 years. And, we very much, because of the criminal reform legislation that was passed and the work that's been done in the White House by Jared and others, we specifically designed the program, and the 5 years was significantly shorter than what had been done before. So we had already taken that into account.
Consideration of
For now, we're not going to do that. But I want to just emphasize, we did take this into account. There were a lot of people that wouldn't have access previously, and we changed those regulations.
Mr. Secretary, the president talked about a phase 4. I know we all understand the circumstances and why businesses need this, but how many more phases can we afford to have, or can businesses expect to have? Do you see a phase 5, a phase 6, a phase 7? What's your thinking on this?
Well, first of all, I very much appreciate the president's support for phase 4. He put out a tweet. As the president said, we would look forward to phase 4. Would be infrastructure. The president's been talking about infrastructure since the campaign. Roads, bridges, broadband, especially broadband now to rural America is very important. We've talked about incentives for restaurants, sports, entertainment, because these businesses have been impacted. The president has talked multiple times about a payroll tax cut. And we've also, we're talking about, in the case of states, we've heard from the governors and the fiscal issues of the states. I think phase 4 will most likely be what we'd need. I think based upon what we're seeing and the reopening of the economy and the amount of money we're putting in and working with the Federal Reserve on 13.3, I think you're going to see a lot of liquidity, and we look forward to business rebounding, especially later this summer.
Just real quick to follow up, and the PPP program, is this the last tranche of money you think you're going to need for small businesses?
We would expect this is the last tranche, but obviously we can always reconsider that. But this is a lot of money going out. Again, let me just be clear. It's another $310 billion here and another $300 billion of loans. That's over $600 billion putting into small businesses, which are the backbone of the economy, 50% of the private payroll.
How much do you think Phase 4 will cost? And it will include all of those things?
It'd be
payroll
premature
costs?
for us to comment what the cost is. We'll work with Congress on that, and we'll consider it.
Infrastructure and
Infrastructure
payroll?
could be a big investment.
That's going to be cheap.
Size of the taxpayer dollars that are going out the door, you fellows come to a different way of thinking about the need for oversight, independent oversight on behalf of the taxpayer.
We have independent oversight. We supported in the last legislation. Let me be very clear. We have a new inspector general. The president has already picked someone for that position. We look forward to the person being confirmed. We have an oversight committee of Congress that many of them have already been appointed. And let me just say, we put up last week for full transparency. We had no obligation to do this. We put up, you can go to treasury.gov, full transparency on the money that had been sent out on the PPP across states, showing all the big lenders, how it was distributed. No one lender did more than 4%, showed the businesses. So again, the president and I very much believe in full transparency. We're spending a lot of money, and we want to make sure that it's done effectively and fairly.
Secretary, thank you. You started by thanking the leaders in the House and the Senate. Can you tell us more about how easy or hard it was to deal with both sides?
Well, we've been working around the clock. I think there's been very good bipartisan support to get this done. The Congress is coming together, understanding the importance of this, and we've been working around the clock for days. So this is important legislation. It was a lot. We spoke to a lot of people. Mark Meadows has been fantastic, as I said. It's great to have him here in the White House. I couldn't have done this without him working on this with me, and the president and vice president have been available to us around the clock. So this was a big team effort.
Collaboration of the Democrats?
Absolutely. We couldn't have done this today without unanimous consent and the Democrats being on board, and we look forward to this being passed on a bipartisan basis tomorrow. This is a real example of the country coming together to fight this virus.
What is your best understanding of what Mitch McConnell wants from an infrastructure package?
Again, I think we're not at the point of designing that. Like every other bill, we will work with senators on both sides on a bipartisan basis. I can tell you there's a lot of support, particularly for things like broadband and especially what's going on today. But the president has talked about, I was on the campaign with the president. We've been talking about bridges and tunnels and rebuilding this country for years. So the president wants to make a big investment in this.
What does Mitch McConnell?
Mr. Secretary, what will we see the $17 billion portion of CARES reserved for companies deemed critical for national security? And also, will oil companies fit into that at all, per the president's tweet?
So we're in the process of putting out guidance. That part was really designed for national security companies that are either major suppliers to the Department of Defense or companies that have top secret clearance. So that national security provision was very clear when we did that. The president has asked me to work with the Secretary of Energy. Obviously, the energy business is very important to us. This has national security issues, but different. And we look forward to both looking at what existing capabilities we have, and that will be something we may need to go back to Congress and get additional funding for.
Similar to the airplane or airline bailout at all, or with that different?
Completely different situation. I mean, what you have with the airlines is, we had a very, very good airline industry. Because of the virus, they basically shut down. We have a situation now with the oil business, partially because of the virus, for less demand, but partially also because of too much supply. But, the president is determined. We want to maintain our energy independence, and the president has asked me to look at all of our options, and we're doing that. Obviously, it's a pretty extraordinary situation where you saw the front month of oil futures trade negative.
Hi, on the issue of the fourth stimulus bill and aid to state and local governments, any thoughts on whether that money should be proportionate to the rate of infection in states so that harder hit states?
Interesting, but way too early to consider that. Whatever we do, we'll do on a bipartisan basis. The president has listened to the governors. I've had the opportunity to be on multiple video conference calls with the president and the vice president. We're reaching out to a lot of people. There's a lot of states that have been impacted, but way too early to figure out that level of design.
You mentioned if a large company applies for one of these loans and maybe manipulates or works the system or works the loopholes to get it, what are some of the consequences to, if a large company tries to get one of these PPP loans? What can you do?
Well, you used the word manipulate. I'm going to give people the benefit of the doubt. Again, we're going to put up very clear guidance so that people understand what the certification is, what it means if you're a big company. Again, there is a provision for, where there are multiple affiliates that people can access this, but the intent was not for companies that have access to plenty of liquidity and other sources. And again, if to the extent these companies didn't understand this and they repay the loans, that will be okay. And if not, there'll be potentially other consequences.
Can you talk about what those consequences could be?
Again, you can look at the certifications. They're quite significant.
Do you have an estimate of how many jobs have been saved with all the money that's gone out in PPP so far?
Well, I can tell you the PPP so far is over 30 million jobs. And again, that doesn't account for other money that we've sent out. And again, we're very pleased. The direct deposits have gone out. We've started sending out the checks. We're also going to be supplementing our capability and sending prepaid debit cards so we can get money out quickly to people. So everything that the president has had us working on is providing significant stability in the economy while we're dealing with this difficult time when, for medical reasons, we've closed down major parts of the economy. Thank you very much.
That was a very nice question.
Thank you,
Thank you,
Mr.
Steve.
President.
See you later. That was a nice question, actually. It's a good question, too. So the noble fight against the invisible enemy has inflicted a steep toll on the American workforce. As we all know, millions of Americans sacrificed their jobs in order to battle the virus and save the lives of our fellow citizens. We have a solemn duty to ensure these unemployed Americans regain their jobs and their livelihoods. Therefore, in order to protect American workers, I will be issuing a temporary suspension of immigration into the United States. You heard about that last night. By pausing immigration, we'll help put unemployed Americans first in line for jobs as America reopens. So important. It would be wrong and unjust for Americans laid off by the virus to be replaced with new immigrant labor flown in from abroad. We must first take care of the American worker, take care of the American worker. This pause will be in effect for 60 days, after which the need for any extension or modification will be evaluated by myself and a group of people based on economic conditions at the time. This order will only apply to individuals seeking a permanent residency. In other words, those receiving green cards, big factor, will not apply to those entering on a temporary basis. As we move forward, we'll examine what additional immigration-related measures should be put in place to protect U.S. workers. We want to protect our U.S. workers, and I think as we move forward, we will become more and more protective of them. This pause on new immigration will also help to conserve vital medical resources for American citizens. A short break from new immigration, depending on the time we're talking about, will protect the solvency of our healthcare system and provide relief to jobless Americans. Today, Vice President Pence visited the hardworking men and women of General Electric Healthcare in Madison, Wisconsin, who are working 3 shifts a day to quadruple their production of ventilators. We're way ahead of schedule on ventilators, as you know. That's why it's never brought up by the media. They don't like to bring things up when we're doing so well. GE is also working with Ford to make 50,000 ventilators in the next 100 days, more than our entire country typically produces in a very long period of time, doing that in a matter of a few weeks and a few days. Earlier today, I had a very productive meeting with Governor Cuomo, as you probably saw. to discuss his statewide testing strategy and how we can work together to help expand it with the goal of doubling testing in the next few weeks. And New York State will be continuing to control the testing of their citizens and will also manage their state and local laboratories. They have a lot of great laboratories there, more than anybody would ever have known, frankly. The federal government will work along with the state on the national manufacturers and distributors. Together, we'll all work together to help them secure additional tests, and we hope that this model will work with the other states as well. I think it will, for the most part. New York has a lot of very exceptional laboratories, but most of the states do. You saw the chart yesterday. Most of the states do. I'm proud of the relationship my administration has forged with New York, and I can say very honestly with New York State and New York City. They've been terrific to work with. The New York metropolitan area has been the epicenter of the outbreak here in America, and the federal government has spared no expense or resource to get New Yorkers the care they need and the care they deserve. We've sent over 5 million masks. We had 5 million masks, and now that number, as of about 2 days from now, will be more than doubled. Thousands of ventilators. In fact, so many ventilators that the governor is going to be sending up some to Massachusetts and a couple of other locations. We have a great deal of ventilators, which people thought would be impossible about a month ago. Thousands of hospital beds, and the USNS Comfort was sent, as you know, to New York, and it was originally for more of a normal medical purpose, and we changed it over so that it could take care of people that had the unfortunate circumstance of going through the problem that we know so well, unfortunately, that we know so well. I said from the beginning that no American who needs a ventilator would be denied a ventilator, and we have kept that promise all over the United States. Think of that. Other countries are desperate for ventilators. They have many deaths because they don't have a ventilator. And I've asked Andrew if we could bring the Comfort back to its base in Virginia so that we can have it for other locations, and he said we would be able to do that. Javits Center has been a great help to them, but we'll be bringing the ship back at the earliest time, and we'll get it ready for its next mission, which will, I'm sure, be a very important one also. But it was an honor. They reconverted it after it got there into handling an event that they were not expecting to be handling. The FDA has now authorized more than 50 diagnostic tests, including, as of late last night, the first test that a patient can take home. He can take it at home, and it's highly accurate. LabCorp intends to make the home collection kits available to consumers in most states with a doctor's order in the coming weeks. We also have 4 different antibody tests already authorized. Tests will help identify individuals who can donate convalescent plasma, thus providing potentially life-saving antibodies to American patients. Dr. Hahn will be providing you with an update on these developments in a few moments. He's done a great job at the FDA. We continue to gain ground in the war against the unseen enemy, and I see light at the end of the tunnel. I actually see a lot of light at the end of the tunnel. And we're starting the process. We're starting a very, very powerful, important process. You see that people are getting very anxious. They want to get going. They want to get back to their jobs. They want to make money. They want to take care of their families. So the light is getting brighter and brighter every day. And with that, if I could, I'll ask Dr. Birx to come up, and then Dr. Hahn. Thank you very much.
Thank you, Mr. President. So looking at all of the information across the United States, we do see improvement across all the large metros. I know you know that we've been talking about the New York metro area, New York City, Rhode Island, Connecticut. Long Island, and really we do start to see improvement there, and we see improvement even now in Rhode Island and Connecticut. The Detroit Metro is doing quite well with significant declines now. New Orleans is nearly back to their baseline of where they started for new infections. We also are seeing improvements in Chicago and Boston, and that has been a great concern for us over the last several weeks, but they appear now to be flattening. Both also Philadelphia and Houston, Atlanta, Nashville, Baltimore, Indianapolis, and St. Louis also appear to be flattening. The DC metro area, we don't see a decline yet, so hopefully all of you are still social distancing and doing everything that you can. I wanted to remind everybody of 2 points. When we brought up and the president put out the guidelines for opening up America again, it was very clear to use data and to really work together to mitigate against any resurgence, and also critically to protect the vulnerable. And what we're seeing across rural America and in some of the smaller population states is we're still seeing outbreaks in long-term care facilities. And we asked everyone in phase 1 to make sure that they continued their social distancing in public, to ensure that the vulnerable with comorbidities and other conditions and among the elderly were staying at home, and making sure we're still providing service to them. But as individual Americans, as we begin to open up, we also made it very clear that individual Americans need to continue all of their hygiene pieces, ensuring social distancing, washing hands, not touching their face, and making sure that they're not bringing the virus home to vulnerable individuals within the household. And remember, those were to continue through all 3 phases. And so really want to call people's attention again to the guidelines. We are continuing to see outbreaks in nursing homes and in confined spaces, and I think as Americans we want to stop that, and we have the ability to do that by really paying attention to the guidelines that were to be in all 3 phases. And so I'm calling on the states again to note that an informed community and knowledgeable community is a protected community. So make sure all of your states have your cases up, visible to the communities, so they can make decisions and understand where the virus is in their community and understand how to tackle it with their state and local governments. This will be absolutely critical. And the surveillance that we called for to find asymptomatics before people get sick as an early warning signal. We ask for those to be in the federal clinics, in our inner city, more vulnerable areas, among indigenous populations, and of course in our long-term care facilities and prisons. We really want to support state and local governments to move forward on these critical monitoring to protect individuals that may be in the most critically vulnerable states. We will continue to see mortality and deaths among our American citizens, particularly in the cities as they begin to move past peak, because deaths will lag. And so we really need to continue to unite and really, really, really support our healthcare providers who are still on the front lines. They have been on the front lines now for weeks and weeks and weeks. And so no matter what city they have been in, they have not seen the relief that we've been able to talk about at the light at the end of the tunnel because of the delay in hospitalizations and deaths. So to our healthcare providers, to our respiratory therapists, and to everyone in the labs, thank you for the work that you're doing to protect Americans and give us one of the lowest mortality rates in the entire world. Thank you.
Thank you very much. Dr. Pierce.
Thank you, Mr. President, and I just want to echo what Dr. Burke said just a few short months ago. I was one of those doctors on the front lines, and I know how terrific they're working and how well they're doing for the American people, and a shout out to them for just the wonderful work that they do every day. So President Trump asked the FDA to remove all unnecessary barriers that were in place to help with the development of both diagnostics and therapeutics, and we have done that. I'm here to give you an update on FDA's efforts around serologic tests, which, as you know, are antibody tests, which detect in the blood the natural immunity that someone might develop in response to an infection, in this case, COVID-19. These aren't diagnostic tests, but these are tests that actually detect the antibody, so an indication that one has had the infection and has responded. And I think it's important for everyone to understand that the timing of the response of the antibody to the infection isn't completely known, but we know that it takes some time to actually develop that. And there's two types of antibody responses that can be detected. And the antibody tests are just one piece of the larger response that you've heard in the America Returning to Work plan that the President has, with the task force, has developed. And this pandemic is truly unprecedented in nature, and you'll see reports around the world of different antibody tests that have been used. And I think that's a reflection of the fact that we're just learning and beginning to understand what that response looks like. And many of these tests have different characteristics that allow to detect at different points in the infection. I do want to address one issue that we are laser focused on at FDA, and that is in an effort to provide laboratories and healthcare providers the early access to tests. We issued a policy earlier in March that allowed test developers the opportunity to quickly get their tests to market and address the needs of the nation as posed by the epidemic. In March, we provided this regulatory flexibility to manufacturers, and here's what we required of them. The manufacturers had to validate their tests. We call it self-validation, similar to what many test developers in the world have done. They had to notify FDA that they had performed that validation. And then they had to label their products appropriately in the package insert with information about the validation, as well as the fact that it's not a diagnostic test, that it's an antibody test. And the bottom line here is that FDA still expects manufacturers and test developers to validate their antibody tests even under this revised policy. Now, we've done a couple of things to actually help end users, to help laboratories, providers, et cetera, states in terms of their use of these antibody tests. One is that we're working with CDC and NCI to actually validate some of the more than 90 manufacturers who've notified us that they brought their test to market, to do an independent validation. And that process is going. We expect to hear more information this week about that, and we will provide that information in a transparent manner. We also want to go after anyone who is saying that the test has been authorized or has been approved by the FDA, but actually hasn't. And we've authorized 4 applications for antibody tests, and 140 test developers are pursuing applications for us as we speak. So it's not okay for someone to say that a test's been authorized or approved by FDA when it hasn't, and we are pursuing them both by in direct contact with the manufacturers, but also at the border. And so we have increased these interdiction efforts, and we will continue to outreach and do that with the manufacturers to make sure that we provide the most up-to-date information to the end users of these products. And we will continue to make all of our efforts, both in the diagnostics and the therapeutics, to help America open up again. Thank you, Mr. President.
Thank you very much.
Dr. Hahn?